Okay, welcome my dear friends. Myself is Professor Dr. Deshpande and today is 15th of April 2020 and this is the, that this is the medicine online teaching programs or the classes of Professor Dr. Deshpande. He has started this activity since last 10 to 15 days when, as everybody knows, that in the world there is a corona pandemic, which is a very sad situation, and it's like a disaster or the calamity on this earth, I can say. And during this period, to what you can say, the support academically and clinically to all the students, Dr. Deshpande has taken initiative, and he is taking nearly Monday to Friday lectures at 12 o'clock in the 2 p.m. and at the 4 p.m. My dear friends, I have already talked to you regarding the cardiovascular system, and today I am interested to start with respiratory problems in GP, that means General Medical Practice. This is presented by myself, Professor Dr. Rajendra Deshpande. As everybody knows that I am MD in Ayurvedic medicine, that is Kai Chikitsa, and MD in Ayurvedic physiology. This is my personal website. This is my WhatsApp number, and this is my mail ID. Okay, so let us move further. This is my mail ID. You can contact me. Anybody can contact me for personal or online health problem advice. Of course, these all the services are paid services. Personal or online lifestyle counseling based on your Prakriti, Ayurvedic Prakriti, and also palmistry. Yes, I practice palmistry as well. Personal or online classes of medicine, and also for Ayurvedic students, they can have the personal classes regarding any subject except Sanskrit from me. Please subscribe my YouTube channel to see the different videos. Nearly 400 plus video audios are there. So this is a disclaimer by Professor Deshpande that these all the audio videos are published here. The sole purpose is education. Can you see here? Only education is the purpose for the medical students, teachers, and medical practitioners. But self-medication should strictly be avoided. If anybody by chance does this by seeing these videos, that is not at all the Professor Deshpande's responsibility for the unwanted consequences that the person has to face. Next. Okay, from here I can go. General rule. You must understand whether you practice allopathy or Ayurveda or even integrated sometimes, even homeopathic practice or naturopathic, you must find out in any health problem. It may be problem of digestion, it may be problem in the heart, it may be the respiratory problem, but every time the you must try to find out. We doctor, we students, we consultant should try to find out the root cause of the problem. Original cause should be find out. This is a type of differential diagnosis. In the modern language, it is called as a differential diagnosis. In Ayurveda, it is called as a Vyadhi Vyavachedaka Nidana. So the question may be in your exam, कास लक्षणाचे व्याधी व्यवच्छेदक निदान लिहून कफज कासाचे सविस्तर वर्णन करा. Write down the differential diagnosis of CAS, clinical feature or the symptom, and then describe in detail Kafaja CAS. So this may be the style of asking the question. But of course, when I teach to the students, of course, there is one part of examination, but most interested, Professor Deshpande is mostly interested that my student should be confident enough for their medical practice. Next, we will go in this way. Okay. So, basic management principle for any problem, for any health problem. In Ayurveda, it is mentioned in very clear words that Sanshepataha Kriyayogo Nidana Parivarjanam. This is the Sanskrit line that you can read over here. But for the English medium that I have written in English also, Sanshepataha Kriyayogo Nidana Parivarjanam. In short, management Sankshepa means in short, Kriya Yoga means management principle is try to avoid. Sometimes we can avoid, sometimes remove, or sometimes you have to treat the causative factors. Okay. So this should be our target. This should be our aim and objective when we are becoming a doctor. Again, take an example, all the time example of the coronavirus. First, the people should try to avoid the contact with the corona patient, with the contact with the what again the surface areas that you should not touch. We should wear the mask. That is all avoid. Okay. If by chance it is there inside the body, throat swab is positive, corona test is positive, then we have to treat the particular symptoms or particular pathology. Okay. Next, this is the in general respiratory system. Everybody knows about that. This is the nasal passage. Then there is the oral cavity. Then the beginning part of your throat, that is pharynx. Then this is the common pathway for food and uh, air, oxygen. Then the specific laryngeal part for the speech. Then the trachea is the main respiratory channel or the srotasa. Then bronchi are there. Bronchi is a plural. Bronchus is a singular. Then the lung parenchyma, and here is also the heart and the ribs. Okay. In Ayurveda, although I have not written here, I also take the separate classes. These are very separate classes. Ayurvedic, pure Ayurvedic understanding of all the Kaya Chikitsa subject. But because of the time restraint, I am concentrating on the allopathic, what you can say, aspect first, integrated aspect first, and maybe in due course of time in our future, when my first year students will reach second, third, fourth year, they will definitely get the knowledge, purely Ayurvedic understanding of any health problem. I am going to teach that also. Okay. This respiratory system in Ayurvedic language, it is called as a Prana Vaha Srotasa. You can write down these some terms: prana, vaha, srotasa. And whatever the doshas concept is there, basically we are concerning with prana and udana vayu. Prano rudistita, prithradeha, I'm sorry, vyano rudistita, but prano atra murdagaha, urak kantacharo, buddhi hridaya indriya chittadru tivana kshavatu udgara nishvasanna pravesha. The main function of pranavayu is nishvasa because of the pranavayu. Pranavayu is a nerve conduction which expands, ventilation takes place. And udanavayu is related with the expiration, uchvasa. Nishvasa to breathe in, uchvasa to breathe out. So prana and udana are the most important vayus in concern with the respiratory system. But that doesn't end because all the vayu types are interrelated. For example, you have the indigestion. Samana vayu is problem. Then also that will affect the prana and udana vayu movement or the current over there. Then if you have the constipation, hard stool, straining, that can increase the problem of your bronchial asthma. Remember my words. So in each respiratory problem, you also ask whether the person, whether the patient has a normal stools. This is very important. Normal urine, because stool, urine, defecation, urination is concerned with apana vayu. When apana vayu is in a normal direction, activities in normal direction, then there will not be any back pressure. If apana vayu is not anuloma, if pratiloma, if pressure is on the opposite direction, that can cause the problem with your prana and udana rhythm. Prana and udana rhythm, current rhythm will be get disturbed if it is a pressure from below diaphragm. And from below diaphragm, the pressure will be because of the pathology in samana vayu and apana vayu. I hope you are understanding a little bit how they are interrelated. Then if you talk about, this is a dosha. What are the dushas? Dhatu and mala. Basically, we are concerned with the rasa, rakta, because they are concerned with the circulation to the lungs and all the respiratory system. Then mouse dhatu, you know that. There are the specific muscles which take part in the deep breathing, which take part in the quiet respiration. Pectoralis major. Huh? So there are different types of the muscles. For example, sternocleidomastoid. Here is the muscle, sternocleidomastoid. When there is a bronchial asthma attack, so here you can see that muscle fiber, tendon, it is acting. So sternocleidomastoid will act only the difficult respiration. So muscles will be there. So mouse dhatu is there. Then of course Whatever the lubricating material over there is because of the made the molecules. Of course, they are not much over there, but asthi is nothing but the rib cage. Huh? Ventilation, diffusion, and perfusion. Please write down three physiological aspects in respiration. Three physiological aspects in respiration. First is ventilation, second is diffusion, and third is perfusion. Ventilation, expansion of the bony cage, antero-posterior diameter is increased. Okay, so there is a huge space, and the air, oxygen enters inside. Oxygen enters inside. So this is a different mechanism. I'm not going into detail to teach you the physiology right now, but you must write down this diffusion, perfusion, and if ventilation, diffusion, and perfusion. I'm sorry, ventilation. Write down ventilation is expansion. Elastic lungs are elastic, expand and then contract. Inspiration is active process, expiration is a passive process. So ventilation is there. Then diffusion, can you see? Diffusion is a oxygen, O2 and CO2 exchange at the alveoli. O2 and CO2 exchange at the alveoli, that is called as a diffusion. And when O2 is released, at the cellular level, that is called as a perfusion. Perfuse, perfusion in the cells. Okay, so that is a dissociation of oxygen from the hemoglobin. Okay, so just a moment, I will do the needful things. Okay, next, respiratory problems in general medical practice. These are some names that we are going to see. Acute rhinitis, hoarseness of voice, acute bronchitis, chronic bronchitis, pneumonia or pneumonitis. It is the inflammation of the lung parenchyma. TB, that means tuberculosis. BR means bronchial asthma, bronchiectasis, and emphysema. These are the main problems that we are going to study. Of course, we are not going into much more details like Davidson Book of Medicine or API textbook of medicine. I am giving you the knowledge must to know in your medical practice. Okay. So acute rhinitis is inflammation of the nasal cavity. Hoarseness of voice, it is indirectly connected with the respiration because speech and respiration, they are interconnected. So hoarseness, harshness of voice, this is hoarseness of voice, change in the voice quality. Inflammation of bronchi, that is bronchitis. Pathology is abrupt within a period of 2-3 days, acute. And chronic bronchitis, there is a history of repeated recurrent cough for many years, that is chronic bronchitis. Pneumonia is a inflammation, acute inflammation of the lung parenchyma. This is tuberculosis, is a specific bacterial infection to the lungs. Bronchial asthma, it's allergic in origin and it is a spasm related with your bronchial tree. Bronchial asthma is mainly 80-90% allergic origin and having the spasm of this bronchial tubes. Spasm, remember this word. Acute contraction, that is called spasm, and so narrowing of the lumen of the bronchi. So the patient becomes a dyspneic because proper air is not coming and carbon dioxide is not going out. Bronchiectasis, what is that? It's inflammation of the alveoli. Bronchiectasis pathology is seen at the level of alveoli. Alveoli are become bigger and bigger and bigger. So when alveoli are big, they secrete more type of the fluid, and that becomes the problem. Too much secretions are there. In emphysema, it's a breaking of the alveoli. After the large pathological conditions in the lungs, alveoli wall becomes fragile, delicate, and they rupture at some places. So what will happen? The surface area where the diffusion takes place, where the oxygen and carbon dioxide exchange takes place, that whole area will be reduced and patient will be breathless. So these are some pathological introduction to you. We will start in many of these cases. For example, I will go back again. For example, in bronchitis, pneumonia, tuberculosis, asthma, bronchiectasis, emphysema, you will find the main complaint of the patient, main complaint is cough. Remember this word. So that's why we are starting with the causes of cough. Of course, the 70-80% causes are related with the respiratory system. But don't get confused. Cough is not only because of the respiratory system problem or respiratory system pathology. Cough can occur because of the non-respiratory causes. You remember the cardiovascular system? I told you that acute chest pain, pura shul, should be considered as a cardiac unless proved otherwise. So there, acute chest pain cause, you first rule out the heart problem. Similarly, in respiratory, 80% major cause is a respiratory cause. But if there is no pathology you find with the stethoscope, with the investigations, with the clinical features, with the history, darshana, sparshana, prashna, inspection, palpation, percussion, auscultation, if you don't find anything in respiratory tract, then where you should find the cause of cough? Is there any cardiac problem? Is there any cardiac problem? Is there any left ventricular hypertrophy due to the chronic hypertension? Is there any right ventricular hypertrophy because of the COPD? Write down. COPD, chronic obstructive pulmonary disease. Have you written? COPD, chronic obstructive pulmonary disease like asthma, like emphysema. Then that pressure, because lung circulation cannot be proper and pressure comes on the right ventricle. So there will be right ventricular hypertrophy. And finally, you know the effect, CCF, congestive cardiac failure. In that CCF, there is always pulmonary congestion. So there may be pink color, frothy sputum, little bit cough, crepitation at the base of the lungs, and cough problem. So this is cardiac. Okay. Mediastinal, the space in between lung cavity, two lungs, there is a one space. And if it is any malignancy is there, tumor is there, then that tumor can press on the bronchi, on the trachea, and then there may be a bout of cough. Many times, cough is a reflex. Cough is a protective reflex because anything abnormal, anything foreign material is entering from nose, entering into the pharynx, irritating to your tonsils, irritating to your bronchi. So that bacteria, that viruses, that foreign body, that allergens, what body is trying to do? Body trying to expel out. It's a protective mechanism. Try to understand. Cough is a protective mechanism. Fever is a protective mechanism. Loose motions are also protective mechanism. Whatever the toxins that are trying to enter your body, whatever the material that is not good for your body, what body is doing? Body tries to throw it away. Body tries to throw it away. So that cough, okay, loose motions, fever, all these are protective mechanisms. Remember that. But they should be under control. They should be under control. If that protective mechanism is too much troubling to you, your physiology, then you must treat it. That is that case. Drugs, some medicines, like for example, you are giving some anti-hypertensive drugs and beta blockers are there. So they may cause as a side effect as a cough, dry cough. So while dealing with the patient, don't forget the simple protocol. Examination methods. There are standard examination methods that everywhere fastly. I'm not saying you waste your time, but while examining the patient, while doing the fast examination, you can ask the present history of the disease, how that disease has been, complaint has been started. That is called the present history. Ask about the past history. Ask about the family history, whether he is taking any medicines, whether he has done any investigations. Then ask about any known case of diabetes, hypertension, blood pressure, asthma, allergy, skin disease, everything. Ask him. Gynecological history is very important. Menstrual history, very important. You may say, sir, why are you are talking about respiratory system problems in this? These are the basic fundamental things on which you can be a good doctor. Otherwise, you will miss something. That's why I have mentioned, if you don't know that patient is on the antihypertensive drugs and that particular drug is causing this side effect as a cough, you unnecessarily waste your medicine, use the Sitopaladi churna, Talisadi churna, Benadryl syrup. It is what you can say, shooting in the dark. When you can call it a smart doctor, who is a smart doctor? Who is not shooting in a dark. Dark means with ignorance, without any knowledge, you are giving some medicines. Lagla matka तर लागला मराठीमध्ये. It's fluke that the patient is getting cured by fluke, not because of your knowledge. That is wrong thing. Then there are some miscellaneous causes. I will discuss them afterwards also, but especially let me tell you the simple things. Subdiaphragmatic abscess, liver abscess, amoeba. If there is a pressure from below, diaphragm is a muscle in between thorax and abdomen. As I am telling you, it's a fact. If peritoneal fluid is accumulated, ascites patient is there, he may have sometimes cough. Then there is one possibility as called as a reflex cough. There are worms in your abdomen, and those worms can cause the cough symptom. Remember, so you must be aware that respiratory is the chief cause of cough, respiratory system pathology, but there may be some another system problem as well. Remember those things. Alveoli and capillaries always have some pictorial in your mind. So you can see here oxygenated blood to the heart. From here it is going out. Deoxygenated blood from the heart. This is the pulmonary arteriole. Okay, these are the alveoli, structure of the alveoli. Pulmonary venule is there. Bronchus. Can you see here bronchus? Okay. Then bronchioles. These are the bronchioles. Then smallest blood vessels, capillary. These capillaries are around the alveolus, and here, see the cursor. Diffusion takes place. Diffusion. Oxygen is coming in, and carbon dioxide is going out. Oxygen in, carbon dioxide out. That is called as exchange of gases, diffusion in the lungs at the alveoli. Because around the alveoli, there is a networking of blood or blood capillaries. Let us think about the basic investigations that are needed sometimes for the cough patient. Number one, hemogram and ESR. Everybody knows hemogram includes the hemoglobin count, red blood cell count, WBC count, white blood cell counts. Then there are also neutrophils, eosinophils, basophils, lymphocytes, and monocytes. These are the 5 types of the white blood cells. White blood cells are called as the soldiers of our body. And another investigation is ESR, erythrocyte sedimentation rate. Erythrocyte sedimentation rate. Hemogram, when the hemoglobin, these investigations are called as a baseline investigations. Any chronic patient of any complaint, remember my words, any chronic patient of any chronic complaint, it may be a case of cough, it may be a case of fever, it may be a case of loose motion, it may be a case of constipation, it may be a case of vomiting, it may be a problem with the urine, it may be the problem with the blood. So always remember what your effort should be to do some baseline investigations. Okay, so hemogram can rule out the anemic condition. Now you will say, sir, anemia is the cause of cough. No, again remember, anemia is cause of everything. Anemia can be cause of everything. It is not a direct cause. It's an indirect cause that the problem gets prolonged. It cannot be cured easily because your immune system becomes weak. So we must know what type of anemia it is. Is it iron deficiency anemia? or is it something else, serious anemia like aplastic anemia, hemolytic anemia? Try to find out the cause, treat that anemia, and also use the treatment for cough. Remember my words. Then you must see the WBC count. Normally it should be 4 to 11,000 per cubic mm. 4 to 11,000. Hemoglobin 12 to 14 gram per cent. Now the count is around 15,000, 15,000 per cubic mm. That can be called as a mild infection, suggesting mild infection. 15 to 20 thousands per cubic mm, moderate infection. More than 20, 25,000 per cubic thousands per cubic mm. Okay, am I right? So that particular WBC count is indicating serious infections. Okay, so we must find out what is the source of infection then. But that gives you the idea. Now, for example, neutrophil count, it should be in between 70 to 75. So if it is more than 80, 85, you can suspect that this patient is having some acute infection. But neutrophils are okay, 60, 65, but lymphocytes are more. Okay, lymphocytes 30, 40, 50, except children, because in children lymphocytes are little bit on the higher side. But in the adult, if lymphocytes are more, you can suspect it may be the chronic infection. Higher neutrophil count will suggest acute infection. Higher lymphocyte count will suggest the chronic infection. And that will be supported by, and can you understand, that will be supported by ESR. If ESR 0 to 10, 0 to 20 mm at the 1 hour, so if that ESR is raised, it also suggests the patient may be suffering from any chronic pathological condition, like for example tuberculosis. In tuberculosis, ESR is always near about 80, 90, 100 mm. But remember my words, you write down these words. ESR is not diagnostic test. ESR is not diagnostic test. ESR is prognostic test. Sadhya sadhyatva. When I start my tuberculosis treatment, every time it is not necessary to do the ESR. Every time it is not necessary to do the sputum. Then what I can do? I can do every 3 weeks or every month ESR. And I will find whether the patient is having first 100 mm, then it is 60, then it is 40, then it is coming down. So, okay, the patient is responding to my treatment. So tuberculosis is one of the conditions where ESR can give you the guidelines whether the patient is going towards the progress in curable direction or not. So ESR is a prognostic value, not a diagnostic value. Stool examination. I think I have discussed about this. That stool for the worm infestation, amoebic infection, because it can cause the refractory cause of cough. So if it is a what you can say, the helminths there, worm infestation, roundworm, bookworm, tapeworm, then you treat them. Anti-helminthic treatment should be given. Then only your cough will be controlled. Okay. The most important investigations in the cough is a chest X-ray, and that too PA, postero-anterior view. This word is very important. This is very much diagnostic for the pleurisy, then pneumonia and tuberculosis. These three conditions can 100% diagnose with the chest X-ray PAV. Pleurisy, pneumonia and tuberculosis. Very easy to diagnose by the X-ray. Then there is another important investigation, sputum examination. For especially here I should mention that sputum examination, SPUTUM, sputum examination. Okay. For AFB, acid fast bacilli, that is Mycobacterium tubercle. But here you must remember that this sputum examination should be done. I'm sorry, this is not the fifth point. It is a continuation of the previous point over here. So just correction. Consecutive 3 days, you must do the sputum examination. Like you remember that hypertension cannot be diagnosed by taking the blood pressure only single time. It should be taken minimum for 3 days in a quite comfortable atmosphere. The patient should be relaxed. Okay. Similarly, sputum examination should be done for 3 times. Sputum examination is not done only for tuberculosis. There are other methods, like for example, if the question mark is there about the organisms, or example, your routine antibiotics are not working, then that particular examination is called as a sputum examination for C and S, culture and sensitivity examination. So then pathologists can detect which organisms colony is there in your sputum and which specific antibiotic can do well for that particular organisms. So sputum examination for TB as well as sputum examination to find out why my drug is resistant. Then there is a bronchoscopy to find out any tumor or some abnormal things in your bronchi or the trachea. So bronchoscopy is very much essential. Then most is PFT, pulmonary function test, is very common nowadays. Every chest physician consultants in the chronic cases of bronchial asthma or the bronchiectasis or the emphysema, PFT is done. This is not done for the tuberculosis. This is not done for the acute bronchitis. This is not done for the rhinitis. This is done for bronchial asthma, bronchiectasis, and emphysema. So pulmonary function test, like you heart, you do the stress test, 2D echo, angiography, angioplasty. So these are the advanced stage. Even CT scan of lung can also sometimes be done. Then even the secretions from the lungs, they are taken out and they are examined for the microscope for bacteria. So advanced techniques are there, but I am giving you the basic idea of the techniques. Pulmonary function test, computerized spirometry. You can advise the patient. Computerized digital spirometry, there you get the lungs vital capacity. Then you can decide whether my patient is suffering from restrictive lung disease or constricting lung disease. I will explain afterwards about that. Restrictive lung disease and constrictive lung disease by looking to the some values of the vital capacity, tidal volume, etc., etc. Then this is peak flow meter is available in the market. You go to the Google or the Flipkart, Amazon today only. You search for the price. It ranges from simple 700 to even 2000. But peak flow meter is a handy instrument that every asthmatic patient should keep that instrument in their house. It's very similar to the glucometer. By glucometer, the patient is understanding his glucose values. Digital sphygmomanometer, by that he can understand his BP. Similarly, bronchial asthma patients can understand his capacity to blow out, expiratory capacity, whether the lung functioning is improving or not improving. In a simple manner, you can judge it at your home by peak flow meter. Then, of course, in your clinic, in your dispensary, you can have the pulse oximeter. You have to just put it over your that instrument and you get the immediate oxygen concentration of the patient in the blood. How much oxygen carrying? 9, generally it should be above 92, 94, 95. But when the patient is asthmatic, when he starts dyspneic breathlessness, gradually his oxygen content goes down, 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 and he requires immediate oxygen. O2 should be given to patient, hospitalization should be done. My dear friends, this is nearly the end of this topic. So you write down this slide number, that is 11. Tomorrow we will continue from the 12th slide number. We are discussing respiratory system problems in our general medical practice. I thank you very much for your patience hearing, and I wish you can propagate these online lectures of Deshpande to your friends and also ask them to join, but without their mics and without videos that can interfere with our lecture system. If you have any questions, you can mail me definitely, and I will one day or the other, slowly and steadily, we can answer all these questions. Okay. So also don't forget to subscribe my YouTube channel. Ask all of your friends of Maharashtra, India, whoever are learning Ayurveda, to get the advantage of Professor Deshpande's knowledge and experience and a passion of